Good afternoon, everyone, and thank you for joining us today. In the Legislative Building in Regina, we have Premier Scott Moe and Dr. Shahab. Joining us over the line in Saskatoon is SHA CEO Scott Livingstone. Both the Premier and Dr. Shahab will have opening remarks, followed by time for questions.
Well, thank you very much, everyone. And today I want to address some of the concerns that I have heard over the past number of weeks as our children are getting ready to return to school this September. This is usually a very exciting time for kids, for students, and for their parents, but this year that excitement has been mixed with some anxiety, and I understand that. And I know that most parents want to see their kids go back to school, but they also have concerns, and they have questions, and they are looking for more clarity about how things are going to work and what things are going to look like. So today I want to provide as much clarity as we can. I want to ensure that we are providing more resources, more information, more time, and more testing capacity to ensure a safe return to school this fall. As you know, the province has provided the overall guidelines and school divisions have released their operational plans to ensure a safe return to school. The province will allocate $40 million from the COVID Contingency Fund for additional costs related to ensuring the safety of our students and staff throughout this pandemic in the classroom. This $40 million is in addition to funding, and it will match and complement the $40 million that the school divisions have realized in savings by not operating last spring, making a total of $80 million total available to school divisions for the safe return to school this fall. $10 million of this fund will be allocated to the Ministry of Education to purchase masks, personal protection equipment, as well as other supplies. $10 million will be provided for non-classroom options like distance learning to help ensure that our immunocompromised and medically fragile students have continuous access to learning. And $20 million will be made available to school divisions for other pandemic-related costs such as staffing and sanitation supplies. Of course, as we know, each and every school across this province is somewhat different. So the specific details of the plan for each and every school will be somewhat different. Things like busing protocols. How will recess work? Which door will my child enter and which door will my child exit from the school? These are the kind of in-school specific information that parents and their children are looking for in the days ahead. And as we speak, those plans are being finalized, and they will be posted online and communicated to parents and students no later than August the 26th. We want to make sure that teachers and school staff have the time that they need to ensure that those plans can be put into action, and to make sure that they are ready when our kids, return to school. And for that reason, we are pushing back the first day of return to school to the Tuesday after the Labor Day long weekend, September the 8th. Students were to return to class between September the 1st and September the 3rd, and so what this will do is it will provide teachers and other staff 2 to 4 extra days to be in the schools, to get trained on additional protocols, to make sure their classrooms are configured properly, and in some cases hold virtual meetings with parents to discuss exactly what the new procedures are, so that everyone is 100% ready for the kids to return to school on September the 8th. School divisions have been working to implement initiatives like block scheduling, cohorting, and considerations for alternating school days if that should be necessary to reduce the class sizes if that is necessary. Under the new funding made available to divisions, additional staff to reduce class sizes in exceptional circumstances may be considered. Many parents are also wondering about COVID testing in our schools. We know that a key to our success in the fight against COVID in Saskatchewan has been very aggressive testing, subsequent contact tracing. And as we move through the stages of the Reopen Saskatchewan plan, we have increased our testing capacity. We have opened up testing to anyone who wanted to test. We have increased increasing our testing capacity has been vital to the success of our Reopen Saskatchewan plan. So we want to see testing increase even more as we reopen our schools. Saskatchewan will increase our testing capacity up to 4,000 tests by the end of this month or early in September. We're also establishing a specific process for testing in our schools. Students will have the option of taking part in randomized voluntary testing with parental consent at their school. Participating schools will be selected based on a number of factors, such as the number of students in the school and if the community is experiencing a recent surge in new cases. As well, in-school public health visits for routine childhood vaccinations will now include the option of COVID-19 testing. Again, that will be with parental consent. Further information will be available soon to all parents regarding providing consent for your child to be randomly tested, as well as other testing options available both inside or outside the school setting. We're also encouraging all teachers and staff to seek testing prior to returning to school and at frequent points throughout the school year. Priority access to testing will be established for teachers as well as staff working in our school system. And I believe Dr. Shahab will have a little bit more to say about testing in a few moments. And about what happens if a student or staff member does test positive. Finally, I just want to say that the most important thing that all of us can do to keep our schools safe is limit the spread of COVID-19 in our broader communities. Together, we've been doing that. So for that, I once again say thank you, Saskatchewan. Today, we are reporting just one additional case in the province out of more than 1,000 tests. This is very positive for our province. We have seen slightly higher numbers over the past few days, but most of these cases have been found through very active and aggressive contact testing and contact tracing, much of it in our Hutterite communities. There have only been about 10 new cases in the past 5 days in the remainder of the province. And that's out of many thousands of tests. So what you're doing in this province, it's working. We have to keep doing it, especially now as we head into the fall with cooler weather and many of us heading indoors. It's how you will keep yourself safe, it's how you will keep your friends safe, and it's how we will all keep our families safe. And ultimately, it's how we will keep our schools safe as our kids head back to school this September. The return to school is an important time for Saskatchewan children, in particular this year. Now that they have been away from their classroom, they've been away from their teachers, they've been away from their classmates for over 5 months now. Kids need to be in school. And of course, all of us, parents and children, need to feel confident that they can return to school safely. That's why we are providing more resources. That's why we are providing more information, more time, and more testing capacity to ensure a safe return to school for all of our students. So thank you very much, and I'll now ask Dr. Shahab to make a few comments.
Thank you, Premier. So I'd like to start by first of all offering my condolences to the families of the 2 individuals who passed away due to COVID-19 over the weekend. And again, it's a reminder that while COVID can impact anyone, serious outcomes are more in people who are elderly. And so our condolences to the families of the individuals who passed away. While we are reporting just one new case today, we did have about 40 cases over the weekend. But we continue to see a variable case number, but overall our case numbers remain low throughout the province. And if you look at our new website with the updated geographies, you can appreciate that many small geographies have had no cases over the past 2 weeks or have no current active cases. And this kind of reinforces why everything we've been doing so far is going to be especially important as schools reopen. We definitely need to keep our case numbers low overall. That will support safe reopening of schools. In terms of our testing rates, testing is freely available in Saskatchewan to anyone who wants it. It's especially now being targeted towards staff and teachers who work in schools and students. They are a priority population for testing. If we look at our testing numbers, while serious outcomes are in people who are 60 and older, for example, our testing numbers are high in young adults and middle-aged adults, so 20 to 39, 40 to 59. Testing numbers are highest in 20 to 39, and then high in both 40 to 59 as well as in children and under the age of 19. So our testing numbers are high in these in persons under 60, which is very good, and we want to continue to encourage that. So children who are school going, their parents really want to encourage testing. If you have even the slightest of symptoms, that will inform us in terms of COVID transmission and risk in the province. It will inform communities, it will inform schools, and then of course isolating when you're sick, will keep us all safe like it has over the last 6 months, and will keep schools within those communities safe as well. In addition, to that, if there's any specific need to go into schools for testing, for example, if there's increased cases in the community, or if there's a case or cluster in school, obviously testing will be prioritized for that school as required and appropriate. So again, the capacity is there, and that will further inform the risk in a school setting. And we have to remember that, while we anticipate that there may be the occasional case in a community or in a staff or person who goes to school, or in a family member of a child who goes to school, we have seen that in general, if you continue to practice what we've been doing, that does not result in large outbreaks. So again, we want to prevent large outbreaks in the school setting, in the community setting, but an occasional case or cluster in a school or in a family of a child who goes to school should not be a cause of concern. And certainly with enhanced testing, we will see the occasional case either in a child who may be asymptomatic, or in a household member who may have mild symptoms. And that is important for us to further inform the community and the school, but it should not always be a cause of concern. Information is really important to help us further manage the school reopening, but it should not always create concern or panic if there's a test positive. Now, with school reopening, and a staff member or school who may be going to school, and public health will be working with schools on a day-to-day basis to manage that. Similarly, if there's a child who's unwell, first of all, if a child is sick, the child should not go to school. But if a child is in school and is unwell, parents will be asked to take the child home and to seek testing. Again, we've seen throughout the last 5.5 months that a test positive rate even now is around 1%. So just because a child has symptoms doesn't automatically mean it's COVID. And with cough and cold season coming, 9 times out of 10, it won't be COVID, or 99 times out of 100, it won't be COVID. And that's fine. We're being extra cautious. If a child has any cough, cold symptoms, child should stay home. If a child is in school, has enough cough, cold symptoms, child will go home, will be tested. 99% of the time, it will be negative. Child can stay home, come back to school once better. But if a child is positive, then there will be an immediate assessment of public health to see who were close contacts of the child, and may not always be everyone in the class, and maybe children who were sitting closer together to the child who may be asked to stay home and will be offered testing, either close contacts or the entire class. And so it will be managed. But again, from what we have seen from cases and clusters in other settings, a child in a class who tests positive does not automatically lead to large outbreaks, and it will be managed the same way it has been managed in workplaces and other settings. In fact, the risk of transmission is likely lower in schools than it is in workplaces. We have had the occasional case or cluster, but not large outbreaks. So with that, I think it's really reassuring, all the work that the school divisions have been doing. Many are updating their plans online, and many are proactively starting at phase 2, which again is another layer of protection. So all these measures are additional layers. One layer can't do everything. So it starts with in our community, practicing everything we've been doing, practicing physical distancing, staying home if you're sick, if you're indoors and can't keep your physical distance, wearing a mask, and then seeking testing at the slightest sign of symptoms, not just in a school-going child, but in any family member, isolating till the results come back, and if it's positive, your close household contacts also stay home for 14 days. And then within the school setting, not sending a child to school if the child is unwell. And then as an additional layer of precaution, as schools reopen, most if not all schools are opening at level 2, which is mask use, especially in older grades. And so all these layers will enhance the safety of school restart, will reduce the likelihood of transmission. And then we will recalibrate. If community transmission remains low, we will recalibrate the level. If community transmission, for whatever reason, picks up, and there have been concerns throughout Canada that there have been increasing cases in younger adults, we will continue to monitor at a provincial level and a local level and readjust what needs to happen at a community level, as well as what impacts that could have for the school at a local level. Thank you.
Thank you, Doctor. Thank you, Premier. We'll take our first question from the phone line operator.
We have Stephanie Taylor with the Canadian Press.
Hi, this question is for the Premier. Your government's plan resulted in many people, both families who are sending kids to school, educators themselves, feeling concerned about the restart of school. Do you accept responsibility and want to apologize for releasing a plan that may have caused people anxiety and fear?
No, most certainly the plan that we had come forward was built to be adaptable, to elevate or to de-escalate given the concerns, and given the concerns not only from parents but from public health as well, to ensure that we our plan can be fluid enough to address the concerns not only broadly across the province but also concerns in individual divisions, as well as right down to the very granular level of the individual schools, which is why we are working very closely with our school divisions. And Dr. Shahab had mentioned that the work of the school divisions should be very reassuring to parents across this province, and they'll be communicating that in great detail by August the 26th on exactly what the individual school will look like. The provincial government has come forward through consultation with school divisions, through the work of the response planning team, with different levels of operation that are available for us to enter into. What we did a couple of weeks ago with Minister Wyant was open the door to a level 2 operation where school divisions could then consider mandatory masking policies if they should choose. We've seen school divisions that have enacted masking policies, I believe from grade 4 to 12, across carte blanche across their school divisions. We've seen other school divisions that have separated some of their higher density, more urban schools. The policy of masking in those schools is different than the policy of masking in some of their less populated, less densely populated rural schools. So the plan as it came out was built to be adaptable. It was built to address what is a very fluid situation. What we have done is built on the funding of that plan in allocating new dollars from our contingency fund into the education sector. This $40 million that is being allocated here today builds on the $40 million in savings that we have in divisions across this province, and it builds on the $42 million increase that we had in this last year's budget, which will be effective September 1st in the school division. So we feel that we have now a very solid financial base, a very solid working base with our school divisions to ensure that we can provide safe classrooms for the return of our students in this province.
Follow up, Steph?
Yes. Why isn't your government doing more to directly reduce class sizes or ensure better building ventilation? Two things that I'm not hearing are being spoken to today, yet many experts, especially doctors and those in the public health field, say are necessary to have a safe reopening to schools. So why not directly address reducing class sizes by, say, instituting some kind of cap or ensure better building ventilation?
First on the class size discussion, that is a layer of protection. We have seen some other provinces that are making some moves with respect to class size. There are other layers of protection that are available. We would encourage all of our school divisions to ensure that they are using all of the capital assets that they have to the greatest ability that they can to reduce class size. Sometimes you will see a larger class size in a particular school. And then a mile away, there may be a school that has some available capacity. And so we would ask the divisions to look, ever so closely at utilizing the capital assets that they have here. There may be some unique situations, not unique, but maybe some specific situations where we may have to provide some funding to reduce that class size. There is also some opportunities, and we are having these active discussions with respect to some facilities may have to look at a level 3 operational plan. And that discussion is happening between public health, the Ministry of Education, and our boards of education on specific facilities, not cross divisions, but specific facilities that may be subject to public health, be at a somewhat higher risk. Should we have an operational plan ready to go for a level 3 operation, which would include alternate days, which would reduce the class size ultimately to half. So on class size, that is an active discussion within not only the government, but within arms of government and our partners at the divisional level. With respect to ventilation, over the course of the last number of years, it's this government that has provided not only funding for 65 new schools and schools with substantial renovations. Many of those renovations have included new ventilation, new HVAC systems within them. It's this government that has opened up the whole preventative maintenance and renewal fund, providing now close to $300 million over the course of the last number of years, and I believe $280+ million over the course of the last number of years in preventative maintenance and renewal to our school divisions for them to prioritize where they may allocate those dollars. Some of those dollars have went into upgrading HVAC facilities in schools on a priority basis. In addition to that, as part of our $7.5 billion 2-year capital stimulus, we wanted to provide some of that stimulus as soon as possible to upgrade some of our education facilities. There was an additional $26 million that was provided very recently, as this past summer, on a priority basis through applications that came from the school divisions as well. So the maintenance renewal of our HVAC systems across the province has received ample funding, as well as our classrooms as a whole. There's more classrooms, there's larger classrooms, and there's more classrooms available for our students. So more work to do to ensure that the layers of protection are in place in our classrooms, whether that's the availability of putting forward a masking policy in those classrooms, whether it's the ability in some areas, in some specific areas, to move to a level 3 operating protocol. All of these speak to the levels of protection that we are putting in place to ensure that we are providing the very safest classrooms possible here in Saskatchewan for the return of our students. You have anything to add to that, Doctor?
I just want to say that as we reopen each sector, we've always been a bit concerned about how will this roll out, and so far we expected to see some increase in community transmission, which we have seen, but overall, all the other sectors as they've reopened based on specific guidance has been smooth, and then as we develop more confidence in how the sectors are performing, the guidelines were changed. For example, restaurants open at 50%, then went to 100%. Schools, of course, there's multiple layers in schools. So all the guidelines that were started from June and have been further advanced in August and continue to be advanced at the local school division level. We can't think of a school similar to a restaurant or a casino. A school is not where you have random mixing of 200, 300 people. There's many layers that are built in, starting from very stringent protocols of not sending a child to school if the child is unwell, to cohorting by class, staggered start and recess time, so that you reduce random mixing within the school to within a cohort, which in many cases for elementary school would be the class. And even within the class, encouraging pods so that children really are more or less interacting on a daily basis with 5 or 10 children who sit in the same place in the class. So all these layers we think will reduce the risk of transmission within the school setting. But again, I think all of this builds upon low community transmission. So schools can reopen safely in communities where there's low transmission, which we have for the most part throughout Saskatchewan. And I think it'll be as important to maintain low community transmission to allow schools to continue to stay open than all the other excellent steps that are happening within the school as well. So I think both things are going to be equally important for school reopening and staying for them to stay open.
I would just add to that quickly. Dr. Shahab brings up a good point. When we reopened the retail sector of our economy, things like restaurants, there was concern and questions across our communities. When we reopened our healthcare sector, reopened our surgeries, some of our diagnostics, our mental health and addictions services here in the province, there were some questions about how we were going to do that safely. When we reopened our community services, so our youth athletics, our splash parks, our swimming pools, our services throughout our community, there was many questions that were being asked. And so we should expect that there are many questions that are being asked when we reopen our schools here this fall. And I would put forward that if this is a very public conversation that we are having, and it's a good thing that we are having it, because we are going to find a place that it will be the safest environment for our children to return to school. All the while that we have reopened the retail sector, our healthcare sector, opened our community services, we have been able to keep the transmission rate, as Dr. Shahab says, quite low here in the province. We're at 172 active cases today. 113 of those cases are in settings of communal living, and we're working very hard with our Hatterian communities across the province, and we're getting to what I believe is a very good place with respect to the access for testing and the aggressive contact tracing that we're doing. But 113 cases of those 172 are in those communities, and 59 are in the remainder of Saskatchewan. So our transmission rate is quite low here in Saskatchewan, even while we safely reopened our retail sector, even while we've safely now have reopened our healthcare sector. We have safely opened our community services, our splash parks, our youth athletics, our softball, our baseball, and we will remain safe because we all continue to do the right thing as we reopen our schools.
We'll take our next question from the room. Arthur?
So I hear that you said that you came to the decision to make this announcement today because of the concerns that you've been hearing, including from educators and parents. But we already knew that educators and many parents were concerned that there wasn't sufficient funding for schools to properly prepare for this weeks, even months ago. So how can you justify the time that we've lost here, the valuable time for school divisions to prepare? And even if you won't apologize for the anxiety that's out there right now, will you take responsibility for that delay and for the rushed schedule we're now facing with only 3 weeks ahead of us?
There is no delay. We still continue to follow the levels of operation that we have here in the province. We have opened the door to a level 2. We've seen a number of school divisions that have moved into that space with mandatory masking across the division. But we see other divisions, like Chinook, for example, that have 3 different levels, a level for their Hatterian schools, a level for their rural schools, and a level for their more populated, more urban schools that they have. So we see in other provinces, there is not a mandatory masking policy in place. British Columbia, for example, does not have a mandatory masking at this point in time. So our plan has always been developed to be adaptable to the situation that we're faced with. The plan isn't changing. What we are adding to is the funding that is available for our school divisions, and been working very closely and appreciate the work that our school divisions are doing on their operational plans, and that is where those plans should be, at that granular level with that local input to ensure that the plans for each individual school address the concerns of their facility and the facility that they have to work with, address the staffing complement that they have, as well as the student complement that is attending that school. But the funding that we have provided here, what we provided this weekend was more information, more testing, more time, and more resources. The funding that we provided is a government decision, and that $40 million that we have provided is new money to the education sector. It builds on the $40 million of savings that is available to the divisions this fall, and of which I believe there will be more, but thus far about $3 million allocated to safety supplies that they will need this fall. So there are funds available, and it also builds on a $42 million budget increase that came about this spring that will be effective on September 1st to the school divisions. So there's been no wasted time. The education response team has been working alongside the Ministry of Education as well as Public Health, and most importantly our school divisions, to ensure that their operational plans are being worked on, and they continue to be worked on today, I believe, for a final submission next week, and and then dispersed to parents by August the 26th. Out of our education response planning team came our 4 levels of operation here in the province, and the province has opened the door to level 2, but is also discussing in certain instances, should we open the door to level 3 for some facilities that we may be required to at some point in time. So nothing has changed. No time has been lost. The work has been occurring throughout the summer, but it should surprise no one that as we near the reopening date of our schools, that the same concerns that were being raised when we reopened the retail sector of our economy, the same concerns that were being raised when we reopened our healthcare, the same concerns that were being raised when we reopened many of our community services and youth athletics are being asked with respect to the reopening of schools. It's a very large sector of our community to send 180,000 kids back to schools across this province. It's something we take very seriously. We've always taken education very seriously, but I think this today's announcement of adding $40 million to the dollars that are already available for our school divisions is a signal of just how seriously we are taking this.
Follow up, Arthur?
This is for Dr. Shahab. You have school-aged children, and I'm just wondering if you've yet made the decision about whether you're going to be sending them to the public school system, why or why not, and how comfortable you feel about that decision.
Yeah, so I think this is a really important question, and there's several reasons for that, because of course, parents have different situations where, for example, in some cases, it's really, so first of all, I'll start with saying that it's really important for children to be in school, both for their educational purposes and for their social development and mental health. And then parents have children in various grades. We've had children in daycare throughout the year, and that's been safe. And then some parents may have children starting school in elementary school. In my case, I have one child only starting school in high school. But parents may be in different situations. But again, in each situation, parents should feel confident, as I do, that when our children start school, it will be a safe environment with both positives and some new ways of going to school. So the positive, of course, is that you're in school, you're learning in an environment which is not only the best place to learn, but also supports your mental, physical development. But also there'll be new protocols that we should, again, start practicing at home. So I've said earlier also that all of us should make sure that we have reusable masks for everyone in the household. We should wear masks at home to get used to wearing a mask for 2, 3, 4 hours if required. And similarly, we should all practice everything we've been doing and make sure our children practice that, hand hygiene before and after eating, before and after using the washroom, being conscious of physical distancing, although at home we don't have to physical distance, but being conscious of physical distancing, and then reviewing our children's symptoms every morning before children go to school. But for older children, certainly making them aware of what to watch out for in terms of symptoms. So having that checklist on your fridge that many school divisions have now posted online, and getting children themselves, especially older children, understand, what things they should watch for. So I think those are the things that, certainly I've been going over with my child who will be starting school. And so with that perspective, I think it is safe to start school. But obviously, in other settings, some household members may have concerns that they, not just from the child's health point of view, and there may be situations where a child may have specific health concerns, where again it's good to have a discussion with the healthcare provider, what can be done. And we have to understand that even children with many underlying health conditions are not necessarily at a higher risk for COVID illness. So it is important to have that discussion with your healthcare provider if your child does have an underlying illness like immune suppression. But then, obviously there may be concerns that in the household setting, are there any household members or people in your virtual bubble that may be at high risk? And I think that's something that we have to think about a bit as well, because right now the summer we may have expanded our virtual bubble to up to 15 people that may include grandparents and others. But as school starts, we just need to be conscious of that children in general, even if they were to get exposed to COVID, do have no symptoms or mild symptoms. But we have to be very thoughtful about what will our virtual bubble look like once children start school, because then they will have another cohort at school and then there's obviously the household setting, and those are some of the things that all of us should think about in terms of our own household situation, who is in our virtual bubble at home, and and of course the child also knowing how to behave before school starts in terms of what's the concept of physical distancing, not greeting other children or other friends in a way that doesn't involve touching or hugging. And I think those are things that we need to practice now, so that once children start school, they understand why it's a bit different this year. It's safe. It's really, children should look forward to go to school, but they should also understand why it's a bit different this year.
I'm just not sure that I heard a clear
Yeah.
yes or no answer.
Yeah, so in my case, my son will go to school. Whether it's level 2 or level 3, that'll be determined by the school division. Because again, I think some of the larger schools may look at what's a safe way for them to start.
I'd add to that, Arthur. That's a good question, and that's the question that is facing every parent across this province: is should I send my children back to the the school, or should I look at some distance learning option? And that is a choice that only a parent can make, given their unique circumstances. Not only the school that they attend, which each one is a little bit different, but their personal unique circumstances with who is in their virtual bubble and who they are in contact with each and every day, and the risks that they have in each of their family. That's why we have provided a portion of this funding to ensure that we are bolstering our distance learning options here in the province for those that choose the latter of those. Understanding every situation is different. This is exactly the question that every parent is asking, and I understand that. I had discussions with family members about just this weekend, and what we are trying to do and what we are doing, did this weekend and doing today, is to ensure that parents can feel confident in whatever decision they make, that we are going to have a safe return to our classrooms this fall. We have heard the calls for more information, and that's why we are asking the school divisions to disseminate their operational plans by August the 26th, so that parents, students, have the very granular, informative information about the operations in their specific school. We have heard the calls that maybe we just need a little bit more time to ensure that our classrooms are safe, and so we have set the start date for schools to September the 8th. This provides our educators and school staff 2 to 4 extra days to ensure that our classrooms and our common areas are safe for the return of those students. We have heard the conversations around testing and contact tracing capacity. We've been actively working on increasing that over the course of the last number of weeks, and we will be at, in very early September, not only 4,000 test capacity per day, but we'll have an active mobile randomized testing availability right within our schools. And we're shoring all of this up with ensuring that people, parents, can feel confident that this government will support the safe return of our students to class by backing it up with adding $40 million of new resources to the education sector.
We'll take our next question from the phone line.
We have Anna McMillan with Global.
Hey there. I'm just hearing some confusion about the financial aspect of this, where people are saying it seems like a non-announcement when it comes to funding. So I'd just like to get a little bit of clarification on language. Why are you talking about this $40 million like it's new funding or additional funding when it's actually just part of the contingency?
It is new funding to the education sector. The government had put aside $200 million for contingency fund should we need it in different ministries across government, should we need it for whatever reason may arise. As there is no manual on how we navigate COVID-19, not only in the education sector, but there was no manual on how we reopen the retail sector, the healthcare sector, or our community sector, our splash parks, our youth athletics here in the province. We are finding our way through this with the best advice of the gentleman to my left, Dr. Shahab, and his office, as well as the advice that we are receiving from people across this province, the education sector being no different. As I said earlier, the education sector received a $42 million lift in this budget, which would begin on September the 1st. They also have access to $40 million in savings in the divisions already, which is still accessible by the divisions. And we are adding to that $40 million from our contingency fund directly into the education sector to ensure that every classroom is as safe as possible for the safe return of our students this fall. And I've been asked why would you add extra dollars when there's already these tens of million dollars that divisions can access? And one of the challenges is the $40 million in savings may not be entirely distributed equitably among our 27 school divisions here in the province. And so if we have a school division that has a legitimate need for resources, and they may have utilized their portion of savings that they have. We don't want that classroom to go without. We want that classroom to have, and that school division to have access to funding to ensure that classroom is as safe as any other across the province. So that's why we have moved forward with this $40 million to ensure that each and every classroom has access to funding to ensure a safe return for our students.
Follow up, Anna?
Yeah, so we've heard multiple times now that this plan ignores medical advice and calls for stricter mandates from doctors across the province. So a question for Dr. Shahab. When you provide health recommendations to the province, do you find that they're typically accepted, or do political objectives get in the way?
So I think, first of all, we have to remember that when we look at even expert consensus statements, and so we obviously do our own research in the province, but we work with the University of Saskatchewan experts as well as experts throughout Canada. But when we look at expert consensus statements, there's nothing that is zero risk. You look at the risk benefit, and if you look at two key reports in Canada, the Sick Kids report in June, that actually came right at the same time as when we announced our reopening plans based on our own research. They were very well aligned. And then we also looked at the Sick Kids report from end of July that has some further enhancements to the recommendations that are aligned with the August 4 enhancements to the school reopening plan. And then similarly, the Public Health Agency of Canada guidance on schools that was first posted, I think in April or May, was somewhat aligned with the Sick Kids report, but then it had some enhancements as posted, I think, in the beginning of August. So obviously, information is evolving on this, and this information is based on the experience from parts of the world where schools have been open throughout the summer, so Australia, Southeast Asia. And again, it is not just how schools open and remain open, it is also contingent upon community transmission. I can't emphasize that enough. Schools are a part of the community. COVID does not travel from schools to the community. COVID travels from the community to schools, and schools are not the incubators of COVID. Community transmission can impact schools to some degree. So I think we need to understand that concept, that the most important thing we have to do is keep community transmission low, and that is the base on which advice for school reopening is based on. But that advice keeps changing based on new information. And secondly, I think it is vital for us to be flexible. We and initially, like in May, June, we thought our transmission was so low that we could start at that time, which at a level which would be considered level 1. But based on our some increase in community transmission, which is still low, but it's an increase that is expected as part of the reopening of various sectors, and then some pockets of more intense transmission that are controlled and are being managed. At this point, the best advice is that it is safer to start at level 2 for the most part, where there's an additional layer of mask use, plus, of course, all the other layers that are important. So it's not just one thing that has an impact. And, of course, where required, level 3. So that is to accommodate large schools with high student density, where you can start at level 3, but again, you may then come down to level 2 after a while once things are working and there's no concerns. So I think we need to be flexible and scalable. The advice also has to rely on the best evidence, and any advice cannot be totally risk averse. I think anything we do in public health, you have to balance the benefits and the risks. That was true for any other sector that has reopened. Otherwise, we could have just remained in lockdown. And similar approach applies to schools. Now, obviously, the concern is higher for schools because our children are going to school. It's a concern because it's a large sector, and those are all valid points. But at the end of the day, we have to move with the best advice we have today and continue to learn. We are watching closely what's happening in the Southern Hemisphere. They've had a very mild flu season. Their protocols have kept a lot of other respiratory illnesses at bay as well, which is something that was very positive, and we certainly expect to see that when we reopen, that it's not just shouldn't just be safe from the perspective of COVID, but it should also keep other coughs and colds at a lower transmission, and we'll be monitoring that closely. And of course, we continue to watch as schools reopen, not just in Saskatchewan, but in Canada and the US and Europe. What can we learn from them in terms of how does community transmission impact schools, and what specific measures in schools are more important than others, whether it's testing, whether it's cohorting, what are the interventions that keep transmission at the lowest possible level. And we will continue to have to monitor that and learn from that and reevaluate our planning and guidelines.
I'll make a short comment on that as well, as I'm as political as the next person in this province, but there's no place for politics in a COVID-19 response, in particular in a global pandemic response like we are working our way through here in this province. So I'm not going to comment on any dueling doctor opinions that may be in this province or across the nation, but we do have a chief medical health officer in this province. It's Dr. Shahab, and we take his advice very seriously, and we implement his advice wherever we are able. Many of the public health orders, public health recommendations that are in place are actually not government public health orders. They are the public health orders that are implemented through the Chief Medical Health Officer's office. They are not government orders. However, they do have the full support of the government, and I would say more broadly, they have the full support of the people of this province, as they are by the vast majority being adhered to, and it shows in our numbers. We are doing well here in Saskatchewan. Notwithstanding some specific challenges that we have had, we continue to do very well here in Saskatchewan because we have very sound advice from Dr. Shahab and his team, and that advice is being adhered to by the vast majority of the people in this province. So I personally would like to take the opportunity to thank Dr. Shahab, not only for his effort, but also for the sound advice that he has provided the people of this province and the collective success that it is providing us.
We'll take our next question from the room. Mark?
The individual school plans are expected by August 26th. Do you feel like that's enough time for parents to see those plans, make a decision whether they want to send their kids back to school or make alternative plans for the coming school year?
I would hope it is. We do ask that that students do attend education in some fashion, whether it be through some homeschooled or distance learning based options, or whether it be attendance in class. This addresses Arthur's question from earlier as well, as there has been no wasted time here. The school divisions have been working very hard with public health and doing very diligent work, ensuring that their operational plans continue to be refined, refined not only at the divisional level, but refined as information changes, but also refined right down to the very school and classroom level. So two things on that. I hope that will be enough time for people to make a decision on whether they will send their child back to school or entertain one of the distance learning options we have. That's why we wanted to be clear in providing this very concise information so that they know when to expect the information by. They don't need to wonder. It may be before that. And then they know when the school date will actually start. So there's no gray area here for parents. And what we're trying to do is provide as direct and concise information as possible. What we're also trying to do in providing the clarity around our testing capacity, in particular the testing capacity that we'll have available in our schools, the resources that we are putting forward to add to the resources that are already available, that the schools and the classrooms that our students will be returning to will have sufficient layers of protection in that particular school, given the uniqueness of each school. They will have the layers of protection to ensure that it is a safe environment for the return of our students.
Follow up, Mark?
Yes, the Prairie South School Division has cut multiple janitorial positions heading into the school year. How concerned is the province about that happening during a pandemic?
I don't know the details around some of the staffing complement, whether it be custodial staff or whether it be a teacher staff in any school division here in the province. So that would be a question that would have to be directed at Prairie South, is that they determine their staffing complement. But we do want to ensure that there are sufficient not only custodial staff to ensure clean common spaces and clean classrooms in the schools, but we were talking earlier around the opportunity that when a student or an educator does arrive in the school, we would hope there are things available. It's going to be a little different. We'd hope there are things available, like, for example, sanitary wipes or Lysol wipes available, and you wipe your workspace down before you sit and actually work on it. Take some personal responsibility to ensure that no matter how old you are, 6, 8, 10, 12, 14 years old, or the educator, the teacher, that your personal workspace is clean before you begin to work in there. I do that in my workspaces. At least I attempt to do that as often as possible. And I think that is one example of how things might be just a little bit different for each of us returning to school. So I can't comment on specific staffing changes that a school division may make. That question is best placed to them. What we're doing is ensuring that the resources are available, and that we're working very closely with the divisions to ensure that there is safe classrooms for our students to return.
We'll take our next question from the phone line.
Maybe not. Maybe I have a few questions for you.
Operator, we'll take our next question from the phone line.
We have Alicia Bridges with CBC.
Can't hear you, Alicia.
I think you guys unmuted the wrong person. This is Anna from Global, and I already asked my question.
Okay.
We'll try that again, operator.
Who has the mute button?
We have Chris Vandenbreckel with CJME.
Hi there. Mr. Premier, you referred to the reopening of the retail sector, the healthcare sector, and other sectors of the economy. Which of those sectors has 30 children in a small room with several staff members in close quarters? And how can you explain how that is the same, and why? Like, this is why parents are raising concerns. It is because of the close proximity of many children.
So not every classroom has 30 members plus in it, plus a number of staff members. However, there are some classrooms that have a larger degree of people in them. So this, I think, speaks to the layers of protection that Dr. Shahab, and Dr. Shahab, you may have some comments on this once I'm finished, probably correct me on a number of items, but this is why we have opened up a level 2 operating procedure for the divisions to enact if they so choose. Some have to different levels, and that is a layer of protection, is to have some degree of mandatory masking for the higher risk students here in our classroom. There may be some classrooms, for example, where a larger number of students in it may have the ability to actually physical distance. And I can think back to my school days many decades ago, where we had a larger number of people that would gather for band class, for example. And just to stop the questions, I wasn't very good in band, and I was quickly removed from that class. But there may be a larger number of people in a class like that, for example. But it is a larger classroom. That is also why what you have raised is also why, in very specific instances, we will be opening up access to some of these dollars to address some classrooms where there simply is no other option to reduce that number in the class. For example, all of the capital infrastructure that school division has available to them in that area is over capacity. There isn't a school a mile or two away that would have some additional capacity. There isn't the availability to maybe look at in specific instances operating at a level 3 operational standard in that specific school or even that specific classroom. So There are a number of tools at our disposal, and we are working through precisely where to utilize those tools, in which schools, in which classrooms, with which school divisions. And this is what makes the local knowledge that school divisions bring to the table in their operational plans so very important. Is a blanket policy doesn't work. When you look at the differentiation we have in our capital infrastructure in our schools across the province, the differentiation we have in our staffing complements in those schools, as well as our student density capacity in those schools, and that's why we need that local input to work on very real solutions for each and every classroom to ensure the safety of our kids. Dr. Shahab, anything to add on some of the risks?
Yeah, no, I fully agree with the visual. When we think about an average class with kids, interacting in a way that is relevant to their grade, it is sometimes challenging to imagine how will school start in the new normal. And I think that's exactly why the last few weeks have been spent on visualizing that. And that is important. So a school must feel safe to children and a welcoming place, but it will be a bit different in terms of how school starts, how recess is, how a lot of the extracurricular activities are, and even within the class, I think things will be a little different, and all of that will provide that extra layer of protection. That in the rare instance, if there was a child who was asymptomatic COVID positive, to minimize the risk of transmission. And again, I have to emphasize that from what we have seen from other jurisdictions, the risk of transmission is lower in younger children under 10. So it's a specific discussion in grades K to 3. And then 4 to 8, the risk of COVID transmission is lower than in younger adults. So it's a different discussion there where the class will be the cohort. And again, the class sizes vary throughout the province and within school divisions from less than 20 to 20 to 24 to a few that may be more than 25. So again, depending on the class enrollment, specific steps around how children are cohorted within the class into specific pods will be important. And then, of course, in high schools, again, there may be some high schools that are rural that won't need to start at level 3 because they can start at level 2 in a way that all grades start on the same day with mask use as appropriate. But some schools that are larger will have to think about starting maybe a grade at a time on some days, and some school divisions have also announced that, so that children, especially those who are starting high school for the first time, get used to the process about what are their entrances and exits, because you don't want, the concept of random mixing happening in school. You want children more or less to stay within their class or their cohort or their block, and even within that to stay more or less closer to the same 5 or 10 students. So I think these concepts are hard to visualize when we think about school starting. I think those are concepts that all of us need to be familiar with as parents, as children going to school, as staff. And we need to practice on those things even before school starts, how to wear a mask, hand hygiene, how to recognize if you're unwell, and then continue to work as families with our children and with schools to make sure that these protocols kept getting followed. But I can certainly understand that the way we remember school is different from what we anticipate school will be as it starts, even though the number of people in classes in some cases may be the same, but the way school starts, the way children have to behave in school and during lunchtime and recess, all those extra measures are designed to, in the rare instance of a case in class, to prevent further transmission.
Follow up, Chris?
I'm hearing a lot of language about some schools may have to do this, some schools could do this. We're hearing a lot of this is left up to choice. Well, who's choice is this? We're leaving this up to local decision makers, but who is making the ultimate decision here, given that it's a public health situation, a public health emergency? Is the final decision on what happens in specific schools being left up to the top doctor in that geographical region, or is it the school divisions that have the final say?
I would say there is, to some degree, a ceiling that is the choice of the gentleman sitting to my left, to Dr. Shahab. We had opened level 2 of the operational levels a couple of weeks ago. We're in discussions in specific instances. Should we be operating at a level 3 response in specific instances that Dr. Shahab and his office have had discussions around with school divisions as to where those risks may be higher, and population density is one of those risks, but there are other risks involved as well. And then it is the school division's choice as to whether or not the province and the chief medical health officer will open the door to that level of operation. It's the school division's decision as to whether they walk through that door carte blanche across their division, or whether they walk through that door in specific facilities. And we've seen both in school divisions across this province when it comes to level 2 operation. But Dr. Shahab, you'll have much more detail on that.
Yeah. So on the public health side, local medical health officers and public health nursing and other teams are in constant communication with school divisions to help them support with not just a safe school start, but also have a common understanding that when there's increase in community transmission, what may the impact be for schools if there's a case either in school, or if there's a case in a household member of a child who goes to school, what are the steps that will need to be taken, and how to support enhanced testing as and when required. So that's the public health side. But also on the school division side, even within a single school division, there may be many schools who are of different sizes and different layouts, and that's where the detailed planning, is my understanding, is happening. That how do you accommodate a safe start, knowing that one school may be very different in terms of number of enrollment, average class size, and other parameters in terms of additional space to enable cohorting as required from another school within the same school division. So a lot of the planning cascades down to the individual school level, but then has to comply with the overarching framework that has been updated and continues to evolve based on the latest evidence. And even once school starts, again, we have set in additional tools to monitor the transmission risk, not just in the community, but within the school as well. And this advice will have to continue to change, because we can't just say, okay, now this is the final word on school reopening. We will have to modify that advice based on what we are seeing in Saskatchewan at a local level, and what we are seeing in other jurisdictions in Canada and other parts of the world as well.
We'll take our last question from the phone line.
We have Alicia Bridges with CBC.
Hi, my question is for the Premier. You've said that you have listened to the concerns of parents and school divisions, but why is the government making decisions about resources and testing based on or influenced by public pressure from schools and parents? Aren't these policies supposed to be based on science and public health advice?
The decision around the testing is one that has began some while ago when we started to ramp our testing up months ago. If we go back to January, Saskatchewan wasn't doing any COVID testing, nor was any other province in Canada, or that to my knowledge. We quickly ramped up our testing capacity at the Roy Romano Provincial Lab to 1,000 tests per day, or the ability to perform 1,000 tests, up to 1,500 to 2,000. We're very near 3,000 tests per day as we speak, and we're heading for a testing capacity of 4,000 tests per day by early September. With that goes the support of contact tracing, ensuring that if you do find a positive test, that we're able to actually do the appropriate contact tracing around that. And with that, we're fortunate. We've seen over the last few weeks our testing numbers, not capacity, numbers, have increased, and our test positive rate remains fairly consistent and fairly low here in Saskatchewan. So we're very thankful for that. So the testing. The ability to increase our testing capacity here in the province is one that we have always been focused on and continue to focus on, and we'll further increase that as other testing in other testing innovation comes to the forefront. Things like reliable serological tests, for example, to find out if you have had COVID. They don't tell you whether or not you have COVID, but they will tell you whether you have had COVID. There's other innovations that are coming to the forefront, not quite here yet, to support less invasive testing, which might be of use in our schools with, in particular, students that are of younger age, as well as looking at some of the science around pool testing, which isn't a large enough pool just yet, from my understanding, to be as useful as we may hope. So all of these innovations around testing, we most certainly continue to have a look at. With respect to the funding is a government decision that was made by the government to allocate $40 million from our contingency fund directly into the education sector here in the province. As I said, $10 million of that will go into providing personal protective equipment, masks, and other supplies that divisions need. And $10 million will go into ensuring that we have are bolstering and have access to distance learning education for those that may need it. We have a program that I had toured in Kenniston, in Sun Country, that is a very valuable distance learning, internet-based program that I think has worked for, and I've talked to students that have taken that program, and it's been very valuable, as has other distance-based learning programs that have been made available in all of our divisions across this province. So the funding that we have provided, it is our hope that funding should further bolster the confidence of parents that as their children return to their classroom, not only are we providing the clarity of information, we're providing the appropriate amount of time, we're providing the resources and the testing capacity to ensure that our return to school is as safe as it can possibly be.
Follow up, Alicia?
Yeah, so when you say that you're listening and you're hearing parents, specifically which of these measures were implemented in response to parent and public concerns, and which ones were already underway prior to this school plan being announced a couple of weeks ago?
Well, all of them have a mix of who we listen to. We listen to the science-based information that we have. This is what governments do: is they listen to the very best science-based information that we have. The very best, in this case, medical information that Dr. Shahab provides us. And we also listen to the parents and the people, ultimately, that we represent as MLAs on both the opposition and the government side of this House at the provincial level. I have heard from many parents that they would like some clarity on the information that is being provided to them. So we have provided the clarity that they will have their operational plans from their school divisions by August the 26th. The clarity around the start date for their school, September the 8th. Schools are going to start across this province. I shot a video on Saturday in front of a new school in Rostern, in the community of Rostern. That school is going to open on September the 8th, just like every other school across this province. So we have provided clarity on the information. We've provided the testing capacity. We've provided funding to ensure that parents can have the confidence that there will be a safe return to the classroom this fall. We have come about that through mixing the very best medical health advice that we have with Dr. Shahab, and he has provided this province sound advice over the course of the last number of months, mixing that with what we are hearing with respect to the concerns of parents and teachers and all of those involved in our education system across the province. That is what governments do, is they listen and then they enact policy as per the advice they're provided.
And that concludes our time for today. Thanks for joining us, everyone.